contacting our current referral sources to let them know, like, hey, you might see a little different plans of cares come in, right? And that was an opportunity to me to coordinate and collaborate with the people already sending, right? Just like showing, like, hey, we're trying to optimize, we're trying to be cutting edge. This is how we're doing this on the operation side, but I'd really like your help to make this even better.
Dan, welcome to the podcast, man. PT Business Blueprint. The goal, I've said this before, I'm going to say it probably for the first 100 episodes, because if I keep saying it, then eventually I'll do it, which is, what if I could have 1,000 conversations with practice owners over the next 5 years, which is still pretty ambitious. That's 200 conversations a year, although I talk a lot. And with the goal really just being able to highlight the different ways that we all address similar problems, which is, how do we deliver care? How do we make that financially viable? How do we make sure we have a steady stream of patients? All those different things. So, Dan, tell us about your practice. Where is it? What's the name? Who do you see? The whole nine.
Sure. So I'm one of the co-owners of Advantage Physical Therapy. It's in Long Island, Nassau County, in Woodmere, New York. This private practice has been around since 1992. I'm just one of the newest owners. I was also born in 1992, so it's like a little full circle moment type of thing. Like, I was born in it, the practice was also born, and historically it's been an anchor in this community. So it had a really good reputation. People loved going here. Before we took over, we had 2 full-time therapists and 2 part-time. Now we have 5 full-time therapists and wow. 2 part-time. With we're adding in our occupational therapist in January. So that's a whole different topic, but that's very complicated to do legally, but we found a way to do it. So we are growing, and we're getting our second location in 2025 also. So so I took over a year and a half ago with my friend, and it's just been growth. And prior to us taking over, they were paper charting. It was like,
wow, really? In 2024?
Yeah, it was hard. So, and so I was just like, I can't do this. My whole career, I wasn't paper charting. I did a clinical out in Peconic Bay once, and I was doing that. And I was just like, I will never do this again.
Wow.
And going through that process where you bring in an EMR, shout out Prompt for being my EMR and helping us get to the 21st century, right? But it was a struggle, right? So we did that in 6 months, and now we're over a year later of being in on an EMR, and that has allowed us to grow in a lot of ways.
Let me ask you this. What was the hardest part? Like adding, so you're a little different, because I think most organizations might make a switch from EMR 1 to EMR 2, but you were doing this. But this is just an example of adoption, and like, everybody wants to be innovative, but nobody wants to innovate, because innovating is hard. Like, there's friction.
So hard.
What were like 1 or 2 of the hardest parts? Was it employee buy-in? Was it like just logistic? Yeah. Okay.
Yeah. Imagine teaching. So we have a great demographic lineup of like a physical therapist. We have the 32-year-old men, so there's 3 32-year-old guys that went to PT school together. And then the previous generation, which is 60 and older physical therapists that have been doing things basically the same way for like 20 years. Right. And so we have young men and grandmas, and it's awesome. Patients love it. We have fun in the clinic. It's great. But like, how can we get everyone on the same page, especially like the front office that was wanting to do things a certain way, right? So you're taking copays differently. You're tracking payment posting differently. You're doing everything, and it's overall more efficient, but changing practice patterns that you've done a certain thing for like 18 years, 20 years is very challenging. And so it was a slow process. It took us about like 3 to 4 months to really like get into the groove with it, but really going and sending all these plans of care to doctors all over again, right? Coming from the new EMR versus what we used to do. That was crazy, like changing fax lines and everything. Like, so much was done. And there's so much to do, but we're finally in like a better groove of things, right?
That's cool. So tell me about the practice. Who do you treat? Who comes through the door? You said it was sort of a staple in the community, so I'm starting to
Mhm.
guess. Do you niche down a little bit, or are you sort of we'll figure out how to help?
You're right. So historically, they were Medicare Part B. So it was basically a geriatric practice. Since I came in, and you can probably see from our social media, now we're treating like little babies that are learning how to walk or have torticollis or are a little bit developmentally delayed. We have people that are coming in for more like vertigo, BPPV, and more of your like recreational athletes as well too. So like since I came in, our percentage of Medicare Part B went from like 90% to like 60, right? And which is hard to do in a practice that has been around for 30 years, is that change that like niche. But like I came in from a private practice. Like I've opened up in my career two clinics, one in Atlanta, one in New Jersey, and like it was all about how can I actually grow it. And at first, I took everyone. Right here, we have the opposite problem. We can take everyone. It's just like how do we best take them? Do we take them in
Sure.
the office all the time? Now we can also see them at their home, and also can we try to get them to have more access because we have a lot of snowbirds here, right? It's in New
Hmm.
York. A lot of them go to Florida or overseas. How can we make sure that they're doing their best and everything we've worked so hard with here that they can have access outside of here? So in a year and a half, we're trying to change the experience to not only be in the clinic, but also in the home, in the gym, at work, and abroad.
When you're saying in the home, are you doing telehealth or is this physically house calls?
Physical house calls. So some people like they've been coming on and off for like years. But what happens when there's barriers to that? Maybe there's cognitive barriers where they can't drive a car, but they
Right.
you don't want them to desaturate. You don't want their functional status to go down. And
Right.
this is very common in the Medicaid population, where like a lot of these people have trouble to get to an office. It might take them a whole day. And
Right.
I don't understand why Medicaid doesn't pay the providers more to just go to them, because it would actually decrease the total cost and the time save and the resources across the entire board. I think
Right.
that's a huge opportunity, and I'm trying to figure that out.
Well, you've got the perfect candidate for physical therapy is the people who have so much trouble even getting to a clinic. That's your jam. And then
Exactly.
there's that gap, right? So some practices are saying, I mean, notably, I worked for a couple practices that were like, we do house calls, like what doctors
Hmm.
used to do. Doctors, if you're sick, you don't come to an office full of other sick people. We come to you because you're already sick at your house.
Exactly.
In terms of that, you talked about a couple different behavior change, one being an EMR, the second being your patient population. How did you change communicating that? Because if you're still operating this, practice has been around since 1992, people thought of you a certain way. You need to change culture. How did you
Hmm.
go about marketing and communicating differently to let people know we're still this, but now we're also this? We've sort of expanded.
Yeah, so a lot of it was me just contacting our current referral sources to let them know, like, hey, you might see a little different plans of cares come in, right? And that was an opportunity to me to coordinate and collaborate with the people already sending, right? Just like showing, like, hey, we're trying to optimize, we're trying to be cutting edge. This is how we're doing this on the operation side, but I'd really like your help to make this even better, right? So they allowed me to call them and say, like, all right, I need a new script for this person. You might see this. Like, it helps the administrative burden if you know it's coming in, and how it comes in is easier to tackle. So the doctor knows, hey, I'm going to be sending 30 plans of cares over. Don't kill me, but they're all going to come in all at once. If you can just knock this out in like 20 or 30 minutes, like ideally, what day would you like them to come in, right? That communication is
Yeah, it's big.
crucial,
It's big.
especially as like a newer owner that wasn't there, right? We still have the previous ownership here too, but just making sure like everyone's on the same page and growing that with new referral sources that didn't historically send here because we weren't cutting edge, where it was harder to communicate with us digitally, right? So now they know what we can do. They've heard a lot of great things over the years, but now it's easier to have that two-way communication.
Here's a question for you. Do you want to boost your clinic revenue by $290 per patient per quarter? Of course you do. That's rhetorical. Physiotech's remote therapeutic monitoring can help you do that, enhance patient outcomes, ease provider workload, and turbocharge your earnings. Kickstart with RTM at physiotech.ca. That's physiotech.ca. And the thing you interact with the most at your clinic, if you're a therapist, like it or not, is your EMR. MW Therapy's all-in-one outpatient PT EMR gives you seamless integration of patient portals, marketing automations, and billing, all at one unbelievable value. Switching over is a breeze too. Kick the tires, take a test drive at mwtherapy.com. And where is your PT career going? It's not rhetorical, it's literal. Embark on extraordinary patient care adventures with Jackson Therapy Partners. Visit them at jacksontherapy.com. This is perfect for physical therapists eager to make their mark, to do what you want to do, where you want to do it. Discover where your career can take you at jacksontherapy.com.
I think a lot of people will skip to the big fancy thing, myself included. This is why it's easy for me to spot. So I love the fact that I asked you a communications and marketing question, and your answer was talking to people, which is actually the goal of running ads or doing webinars or workshops. It's like, that's actually the goal. So you were like, we didn't do anything fancy, and it worked. Sounds like it. We didn't do anything. And that's what, you hear people who are experts will often refer, whether in PT or communications, which is do the basics. I know you want to get fancy, but fancy is complicated and expensive and time consuming, and it could work. A lot of times you're more consistent. The basics work more frequently.
So much. And like the easiest thing to do is a practice that has been around for 30 years, has touched a lot of lives. There's a lot of value there. If you can just call them, like if you can have that touch point that that have historically seen them like once every 2 years or once a year, call them. Even if they don't reactivate and become a patient, right? They're going to tell their friends like, hey, my physical therapist just called me, and because it was my birthday, and because we had such good records, like it was easy to plug everything in, and our EMR kind of told us, and we just called patients because it's their birthday, right? Or an anniversary, and we have that on file now, and they're going to tell 5 of their friends that they play mahjong with or this or that, and then one of their friends, a family member, might need it, and just because you're in their head, right? Because you have that warm touch point, that's the best marketing that you can even do. That doesn't cost you any money, nothing.
Yeah. It's smart. It's communication. It's the basics. Most of the time when I do communications presentations, my first slide is 2 tin cans and a string. That's it. You're trying to get information from one place to the other. Don't overcomplicate it. When someone walks into your clinic, what's it look like? We often talk about, hey, we can add bells and whistles. Adding everything is usually never a good idea. But what do you have that you find useful in your clinic?
Yeah, the most useful thing we do have is our people in the front. So we haven't evolved, and I don't think we are a good candidate to evolve to where we have a screen there. Maybe one day when my front office retires to like Florida and she can pop up on a screen on the beach, like people would love that because it's the same person. She's just in her next phase, but she has been around here for like 20 years. Hopefully we can do that, but like we have people and we have the same setup. We have chairs there, this and that, but my pet peeve is waiting at a doctor's office. So I try for us not to use those chairs. That's only for like people's aides or their family members that feel like they're like in the way, or their drivers, right? Like when a person checks in, I don't want them waiting in the chair unless they're like an hour early, and even then I'll try to like squeeze them in early if I can. But I want them to come right on in, because that just helps the patient experience. Time is the like greatest asset. I don't want anyone waiting. I want them moving. I want them engaging. I want them to have that experience. I want them seeing their neighbors, and I want that community feeling. I want us to be a busy Starbucks that people are just talking, engaging, moving, getting like their metabolism going. I want all of that, and I want it to be fun. And so I ideally don't even want a waiting room, but I have to have one for
Yeah.
everyone else, right?
Yeah. All right, you did something, or you're doing something a little bit different. Let's talk about Private Practice Network. Now, this is an IPA, which talks to me because I do like craft beers. Right? IPA, it's so. Help me understand what is it? Why'd you formulate it, and what's it allowed you and 79 other practices to do in the state of New York? This is new and this is innovative, and I like talking about stuff like this.
Yeah, so recently, myself and I think 8 to 10 other private practice owner, we've created a steering committee for the first Private Practice Network IPA. And IPA is an independent physician association or independent practice association. And what it does, it allows you to collaborate as a group for like contracting and billing and credentialing and operation, but you still will have your own entity being your own private practice. Historically, this was done with your primary care physicians, maybe a few specialists, but it hasn't trickled down to us in the PT space. A lot of it is just because like it's hard to make it.
So is it a way to group yourselves together without having to become a franchise or having to business wise sign and join? So it's a way to sort of group together formally, but you're not now one business entity.
Right. Everyone is a shareholder and they are all together in this one thing. So you have an equal say in this group, and it doesn't matter if you have 5 offices or 1 office, but at least you can pool together your resources in order to get like maybe better EMR costs, maybe better software as a service costs for like these AI scribes, but also negotiate with payers and just show, hey, we're seeing this many visits per month altogether. This is a lot of claimed volume over several zip codes. This is how many providers we have and all their specialties and demographics. And some of us do visits at the home and this and that. So it allows to provide more access, more and to help more lives with different types of people, which we know New York has a lot of different types of people.
Physical therapists, if you're not up on blood flow restriction training, you're missing out. BFR, it's the future of rehab. Owens Recovery Science has the certification for learning BFR from the ground up. You'll get hands-on with the best tech, expert insights, and tools to deliver real results for your patients. Stop waiting. Check out owensrecoveryscience.com. That is owensrecoveryscience.com, and get certified in BFR today. Physical therapists, if you're ready to stop playing small and actually master your specialty, Brooks Institute of Higher Learning is where it's at. Imagine one-on-one mentoring, hands-on labs, top-tier facility, all while earning a full salary and benefits at Brooks Rehabilitation. We're talking 8 cutting-edge residencies, specialized fellowships, and a 93% board pass rate for graduates. Get trained by the best with the best. Check out brooksihl.org. That's brooksihl.org, and start leveling up your career today. Well, it's got to help you negotiate better too, right? And there's the strength in numbers in terms of paying attention. Now you get paid attention to. We hate to say it, but now you're, instead of being 80 individual squeaky wheels, right, which can be ignored sometimes, it's just how things are. You're one pretty large squeaky wheel if you're all squeaking in the same direction.
You got it. And the payers don't have enough resources in order to hit all those 80 different squeaky wheels. They want one really good, nice wheel that operates really well. Like they will reward that entity that operates more efficiently and timely and compliantly, right? So it's nicer to be one entity. They want to do that, and they want to incentivize that. So they'll raise it up, right? So an IPA is one way of doing that, but there's another way, and that's with an MSO, which is a managing service organization, right? So this is a service or an entity that will handle those needs. They might help you with administrative burden by like checking your eligibility, authorizations, billing, compliance. So this is another thing, but you don't have a say there, but they operate very efficiently and they can help you, and you pay them a percent or a fee like every year, and they'll help you with the pair relationship piece where like they have a legal team that will like look through the contracts and everything and be like, we don't want this, no prior authorizations, right? We
Right.
need a higher fee. So all of that. So that's another vehicle to negotiate with payers that you can do as a small mom and pop, because you have to, because I tried for 6 months to get them on the phone. They didn't want to talk to me. The network was closed. I wasn't allowed to see those patients, but it was a lot easier to go through them. I got credentialed in 30 days.
Got it. So this is available. This is a thing. So I
Mhm.
mean, you and I are, we were on LinkedIn and you're in Facebook groups and you see people complaining about things. And listen, I love me some complaining, but you're actually being able to execute and say what are the strengths if we pool together, if we come together, and be able to say now we can affect change.
Right, right. I think the worst thing we can do is try to compete. Like this
Can't do it.
right, like that's not good for our profession as a whole. And we have a shortage. Like we know there's a shortage of providers. Like this is our time to strike because we have supply demand, right? We're all super busy. We're just our X isn't high enough. What we're getting paid per
Correct.
visit is not enough to keep our lights on. And that's not good for business, because if there's only one option, it's never a good thing. You need a competitive landscape to innovate, to push. And I'd rather us compete on our people, like having the best specialists in the clinic and that we pour resources into and we have a good culture with, and how we operate as businesses. Like, do you get people in within 24 to 48 hours? Do you communicate well? I would rather us compete on that rather than try to just compete to have the most business, because there's not enough physical therapists. And we know this. And what I'm trying to do is we need legislation and policy that says, hey, you need a certain amount of PTs for 10,000 lives or 100,000 lives, because that exists for primary care, exists for your dentist, but it doesn't exist for us. And that's a problem, because there has to be some sort of what is enough and what is too much. And we have to be able to regulate that.
Kudos to you. 80 organizations. We said this before I hit record. Like getting
Yeah.
8 people to agree on something is not easy. Never mind 80 business owners who this is their livelihood, who say, okay, I'll invest time and a little, and money and resources into coming
Mm-hmm.
together and doing this. That's
Mm-hmm.
not easy. So kudos for you and the and the rest of the board on that organization for going ahead and organizing.
Yeah, we have 8 to 10 people on the board that have been private practice owners for like way longer than me. I'm learning so much from all of them, but we have 80 types of practices across New York State that have pledged to even join.
That's great. Biggest lesson in putting something like that together? Biggest thing that you've taken away or learned that wasn't expected when you went in?
Uh, Make sure there's one mission, one voice,
Yeah.
and having someone with legal background is so crucial.
Huge. Yeah.
It's so crucial to like simplify things, right?
Yeah. Yeah. It's funny is like we look at these things and they say they shouldn't be that hard, but there's some things that you just can't go around. And, legal is typically one of those things where it's like, well, and it's also one of those things, it's a landmine, you step on it or it could really sting you.
Oh
You
yeah.
want to make sure you don't get stung there.
Oh yeah.
Last thing we do on these short episodes, parting shot. What's something you'd want to leave with the audience? A mic drop moment, a soapbox statement, something you want to leave as we wrap up.
Yeah. So, especially in 2024, I think all of us as physical therapists need to be more involved with policy. We have to collaborate more, especially with our peers in government, our peers in private practice, in hospitals. Like our biggest enemy is ourselves. If we can all pull our resources and time together, whether it's 5 minutes or 1 hour every month, where we can actually just write to a representative, or get them to visit us in the clinic, or get them to be a patient of ours, right? To
Yeah.
demonstrate our value and our biggest barriers. That's all it takes to get that ball rolling in the right direction. And
Yeah.
we're starting to see that in the past like 3 years. There's been like Health Transparency Act where we know what everyone's getting paid. We're seeing better access points, less administrative burden. Like you go APTA, you've been crushing it for 3 years. Let's try to get like that economic shift where the fee schedule is going the opposite direction. And I'm seeing potentially it might go up this year, but it's requiring all of us to get involved politically. Just send letters out, and if we have enough, if 20 therapists in every zip code, just messages it, that's huge.
Yeah. Understood. Make your voice heard. That's how decisions are made.
Exactly.
Dan, appreciate you doing this for the profession. Maybe it'll catch you on. Maybe other people will start paying attention to these different ways that we can connect and make your collective voice heard. Appreciate you coming on the show and doing this for us.
You got it, man.